Nurses, I'm excited to introduce our new fleet of wheelchairs. These advanced models are designed to enhance patient comfort and mobility. They feature adjustable features, ergonomic seating, and improved maneuverability.
That sounds great. How do these new wheelchairs compare to the ones we currently have?
The new models offer superior comfort and support, reducing the risk of pressure sores and discomfort during extended use. They also have a more intuitive design, making them easier for patients to operate independently.
That's fantastic. Will this improve patient satisfaction?
Absolutely. By providing patients with more comfortable and functional wheelchairs, we can enhance their overall experience and improve their quality of life.
Are there any specific features that we should be aware of?
Some of the new wheelchairs have built-in features like cup holders, storage compartments, and even lighting for nighttime use. It's important to familiarize ourselves with these features to ensure patients are using them to their full potential.
Mihira, I understand how worrying it could be to see your child in discomfort with an ear infection. As a parent, you want nothing more than to make them better right away, and it's natural to hope for a medicine that will fix everything immediately. I want to reassure you that ear infections are very common in children, and our bodies are incredibly equipped to handle them. In many cases, a child's own immune system can successfully fight off the infection, and it will often begin to clear up on its own within a few days. Because of this, the very best and safest first step is often careful monitoring instead of immediately starting a prescription. My role is to ensure we provide the most appropriate care for your child, and that means sometimes resisting treatments that may not be necessary or could even be counterproductive. Using antibiotics when they aren't essential can lead to side effects and can contribute to the bigger problem of antibiotic resistance, which makes these important medicines less effective for everyone in the future. So for now, let's focus on making your child comfortable with pain relief and keeping a close watch on their symptoms. I will guide you on exactly what to look for and when we should reassess if things don't improve as expected. You are not alone in this. We will navigate it together, prioritizing your child's long-term health and well-being.